Boa tarde a todos. Meu nome é Carlos
Good
Eduardo.
afternoon, everyone. My name is Carlos Gouvêa. I'm the Executive President of CBDL. I would like to thank all of you for being here, watching this video. And this is a very important sign of the support and the importance that we give for the scientific development. And nothing better than using this moment to talk about antimicrobial resistance. Here, I would like to thank, before anything else, Professor Rosanna that accepted our invite. Unfortunately, she couldn't come to the Brazilian Society of Clinical Analysis event a few weeks ago, but she's here and she has a great commitment with SBAC to launch this series of case studies. And we're continuing a series of events that we already started in the previous year and that we're going to continue this year. And you're going to hear about this series in this very event. I would like to also thank Dr. Maria Elizabeth Menezes. She's our partner, and she's been doing an amazing work with the SBAC, the Brazilian Society of Clinical Analysis, and it's a very important moment for the market of laboratory analysis. And to start, I'm going to invite Dr. Elizabeth to give us her initial words, to talk a little bit about our Congress, which was amazing. I believe we had a great number of participants and we had also great talks. So Dr. Elizabeth, welcome, and you have the floor. Good afternoon, everyone. Thank you, Carlos, for the invitation. It's a pleasure for the Brazilian Society of Clinical Analysis to be part of this program of scientific cooperation, which is the base of a scientific society. And we're very happy to have Dr. Rosanna from the International Diagnostics Center at the London School of Hygiene and Tropical Medicine. The idea is to be able to tell all of our associates and convey the importance of continued education. And continued education should not only be in the Congress, even after the Congress. Of course, our Congress was very successful, our meeting. I believe it was a great scientific amount of content, and also due to everything that we heard from the speakers and the participants, we really believe in the success of that Congress. And Dr. Rosanna, she had a talk. She had 2 days that she was going to talk about the antimicrobial resistance issue. Unfortunately, she couldn't come, and that's why I would ask everyone to watch the first course that we did together with Dr. Rosanna and with CBDL. It was truly amazing. All of our associates were able to have a great evolution in their knowledge in the area, and now I would again ask for everyone to watch that back. And we are also going to watch the link to our Brazilian-speaking countries, everyone that was at our Congress. And more than that, I would like to extend my thanks again to Dr. Rosanna. Her, together with CBDL, wanted to have a participation with SBAC with the goal of bringing to everyone and the furthest possible, whatever is the most new information for our labs to have a competitive differential. So I would like to welcome Dr. Rosanna, and now we're going to hear what she has to say. Good afternoon, everyone.
Thank you very much, Dr. Elizabeth, and it's my great pleasure to be with you today on the launch of the AMR course case studies series in Brazil. Let me first share my screen to start my presentation. What I like to do today is to be able to share with you what the latest situation is with regard to antimicrobial resistance. We are at a world crisis, and urgently we need to all do something about that. And so what I would do is to first talk about the global crisis, the situation we're in, and then talk about the course that we developed and ran in March, at the end of March this year, and what were the course objectives, the curriculum, and who developed the course with us and our partners, and then some idea of the how many learners, etc. And then I want to go into why we developed a case studies series to follow that course, and then what next. Now, if you recall, in 2016, Lord Jim O'Neill published a report where he based the situation of the antimicrobial resistance in the world. At that time, there were 700,000 people a year who died from causes attributed to antimicrobial resistance. And he projected, if we don't do anything, by the year 2050, 10 million people would die from antimicrobial resistance. And that actually will exceed the cause of death, more than cancer, more than diabetes and other diseases. And the cost in terms of global loss in productivity, it would amount to about $100 trillion US, and 28 million more people would be pushed into poverty because of paying for more expensive drugs and having to stay in hospital longer because of antimicrobial resistance. Now, in 2022, that's just last year, a study was published, and the study was done in 2019, and it was based on data from many countries and on 88 pathogen drug combinations. And they estimated from all the data that worldwide, we're now at 4.9 million deaths occurred due to or associated with bacterial AMR. And this is much worse than what Lord Jim O'Neill predicted in 2016. And of course, we know from the last 3 years that COVID-19 pandemic has really exacerbated the AMR situation in most countries, with most of the patients who are hospitalized for COVID receiving antibiotics, whether they needed it or not. It was estimated by a study that was conducted by WHO that 70% of patients hospitalized for COVID received antibiotics. Now, if you look at this data from that paper, from the 2022 paper, you'll see that the areas of the world with the highest antimicrobial resistance rates in Africa, followed by East Asia, and then Eastern Europe, and then Southern Latin America. So all areas of the world have really are affected by this pandemic, and really something needs to be done quickly, urgently. And the situation in West Africa is especially urgent, because we've known from studies that were done back several years ago that antimicrobial resistance in West Africa has been very, very prevalent, and especially urinary tract infections, bloodstream infections, diarrhea, people with pneumonia, etc. And now we know that the death rates in West Africa are about 27.3 deaths per 100,000, which is very, very high. And the Financial Times actually said, antibiotic resistance in Africa, that's a pandemic that's already here. Now, just last month, in June of 2023, WHO published a study that has been that they've been carrying out for quite a while to look at what is the global research agenda that's needed for us to be able to fight this antimicrobial resistance pandemic. And they published a policy brief last month, and in it is the figure in the middle, which it shows that there are various areas that we need to pay attention to, such as prevention, diagnostics, treatment and care, and then some cross-cutting activities, and then drug-resistant tuberculosis in particular. And if we look at the diagnostic part of this global research agenda, you'll notice that priority 7 out of the entire 40 items of the research agenda, priority 7 is investigate and evaluate diagnostic tests for detecting pathogens and antimicrobial susceptibility testing. And that's precisely what we were doing with that first course on the microbiology laboratory in fighting AMR. So in this course, our course objectives were to define the role of diagnostics and the laboratory in the global fight against AMR, and review techniques that are used in the laboratory in low and middle income settings to guide antibiotic use for patient care and for AMR surveillance, so that we know where we are, whether we are doing a good job with controlling the use of antibiotics to reduce the threat of AMR or not. And then finally, to understand how the results of antimicrobial susceptibility testing can be better used to improve clinical care, to monitor healthcare-associated infections in hospitals, and for AMR surveillance, both regionally, nationally, and globally, so that we know where we are with regard to the fight against AMR. And the curriculum is divided into 3 weeks. In the first week, we go over the global situation for AMR and the role of the laboratory in the AMR response and in surveillance. And then we talked a little bit about the impact of the COVID pandemic on AMR. In week 2, we describe the mechanisms and the procedures for determining antimicrobial susceptibility and how to detect resistance genes by DNA amplification methods. We also talked about the need for good clinician-laboratory interface in order to use this testing data and susceptibility data better for patient care. And then the third week, we talked about how to use the laboratory to screen for resistant infections that are in hospitals and in long-term care homes. And these are what we call healthcare-associated infections, and how this relates to our environment and in animal health, and also how the laboratory needs to make sure that the quality of the testing and the results are used appropriately. And we talked about opportunities for professional development, and that we need a culture of continuous learning in an environment where technologies are changing very rapidly. We're grateful to a lot of partners and faculty for helping us develop the curriculum, and they bring to us from different countries, different points of view, different ways that things have worked or not worked. And so besides our core faculty, and I recognize the hard work of my clinical research fellow, Dr. Noah Fongwen at the London School, and he's now also head of access at Africa CDC, and then Dr. Debbie Boras from the Global Health Impact Group, who has been very key in getting this course organized together and all the technical aspects of it. We're very fortunate to have guest faculty from, as you can see from this slide, from all around the world. from our partner institutions as well, including Dr. Secondo Leon from Peru, and of course, Carlos Gouvêa from CBDL. And also we have Dr. Ram from India, and Dr. Simbi, and Dr. Dembi from Africa CDC, from Africa, and our colleague David Moore from the London School. We're very grateful to the St. Boniface Hospital in Winnipeg for us to be able to film the procedures for the antimicrobial susceptibility testing. And we're grateful to partners all around the world for disseminating this course in Spanish, Portuguese, and in French. Now, with the partnership with Africa CDC has already started a long time ago when we first discussed how to set up laboratory testing in Africa. And so this is a long-term partnership, and our courses in Africa would benefit from the course being in not only in English, but in French and Portuguese as well, so that everybody in Africa who speak those languages can access the course in language that they're most comfortable in for learning. And this is also part of now Africa CDC's plan for how to respond to AMR on the continent. Our regional courses, the Portuguese, we partner with Aladif, which is headed by Leticia and Carlos. And the courses reinforce the need for a diagnostics observatory where we have systematic identification of new and emerging health technologies with the potential to impact health and health services and or society. And this is very relevant for AMR because we need faster tests to know whether a pathogen is susceptible, what antibiotics can we use, and which can we not use. The course is endorsed by SBAC, the Brazilian Society of Clinical Analysis, and we hope that there will be more partners in Brazil as we go along. The Spanish course, we partnered with the private university San Juan Bautista in Peru, and the course will be part of the teaching curriculum for technicians. The French course, we partnered with Institut Pasteur in Dakar in Senegal. And there's a lot of very enthusiastic responses for the Francophone training, and they keep asking for more materials and more educational courses. So all in all, since we launched through the course in March 2023, there's almost 3,000 learners from 134 countries, and you could see them listed in here. And the countries in bold are the countries with the highest numbers of learners. And we had a lot of very good responses from the survey that we took. There were 833 responses to our survey. Most of the learners find the course very comprehensive, and they would like to know more about particular subjects, and that gives us the incentive to keep on giving more courses in areas where people feel that they need to have more in-depth knowledge and expertise to deal with it. And you could see at the bottom for our next course, in September, we're going to launch a course on healthcare-associated infections, because hospitals are now, since the COVID pandemic, full of resistant bugs that can lead to death. And so hospitals are becoming unsafe places to seek care, which is very ironic. And so what we want to do is to help countries with knowing how to take care of, monitor healthcare-associated infections, make sure that people go into hospital would not acquire these resistant bugs and die from them, and also how clinicians and workers in hospitals can help the lab with keeping the hospital safe. And the lab, of course, is very important, so that if we're making good progress, the lab data would show to everybody that the number of resistant infections are coming down. And so this is where we know what to do next. Now, in the meantime, why did we launch a case study series? I think the regional faculty and partners highlighted the impact from the course. For example, new initiatives that arose because of the course, and an endorsement from professional societies, and the request for more educational material. And we have the learners' feedback to inform us on the needs to be addressed through the future courses. The learner engagement and continual momentum for advocacy and awareness is something that we want to somehow maintain, instead of just keeping the learners engaged during a course. We want them to be engaged on an ongoing basis, so that we build a stronger community of healthcare professionals and educators to fight AMR through laboratory testing. And these case study series are meant to be interactive, informative, relevant, practical, and would contribute to everyone's continuing professional growth. So what next? As I said, we are going to have a course on the laboratory in the prevention and control of healthcare-associated infections, making healthcare facilities safer. That's our final aim. Now, the definition of healthcare-associated infections are infections that patients acquire in healthcare settings when they go into a healthcare setting for whatever reason. And these healthcare settings include hospitals and long-term care facilities, such as nursing homes. And why are they important? You could see that from the Lancet paper that was published in 2022 on the global burden of bacterial antimicrobial resistance in the year 2019. We could see this graph, which shows the top causes of deaths due to AMR. And if you look, these, E. coli, Staph aureus, Klebsiella pneumoniae, Streptococcus pneumoniae, Acinetobacter baumannii, these are all top causes of healthcare-associated infections as well. So that's why it's really important for us to address this topic. And in the European Union, we have a study that was conducted to show that in the European Union and European Economic Area, 75% of disability-adjusted life years attributed to AMR are due to healthcare-associated infections, and that these infections result in a significant economic burden on health systems, increasing the morbidity and mortality of patients, lengthening hospital stay, and increasing healthcare costs. And of course, patients and families also pay out-of-pocket expenses for their families being sick as well. And so the European community decided that actually infection prevention and control interventions were identified as amongst the best buys modeled by the researchers in that region, in that every investment in infection prevention and control to prevent HAIs would yield a 7-fold return in reduction of costs. So it is a very cost-effective intervention, and we would like to tell you more about them. And here is a slide from the course that shows the position in green, in the green circle, of a microbiology lab in the organization of a hospital and the antimicrobial resistance stewardship committee, as well as how it relates to all the different departments of the hospital or the healthcare facility. And so this is a list of basic antimicrobial stewardship interventions. And you could see circled in green, work to establish basic microbiology laboratory facilities and work to establish regular surveillance activities of healthcare-associated infections. And so with that, I'd like to thank you, and hopefully that gives you an idea of why we did the case series and also a teaser for the upcoming course in September. Thank you, Carlos, and thank you, Dr. Elizabeth.
Thanks a lot, Rosanna. It was great to see. This is really a good teaser for the future activities to come, not only in terms of education, but I think as stakeholders in the society, and I'm sure Elizabeth agrees with me, we have a very strong responsibility to really take action and to prevent the worst to come. Actually, we really have to avoid this kind of terrible situation that AMR can cause to the humankind. That's very clear. So I don't know if you want to turn off your presentation so we can have to take it off.
Yeah.
Fantastic. But I really invite all the people that are watching or will watch this video to not only to enlist for the next one, the September course, as Rosanna indicated, of health associated infections and what is the role that the lab can play inside the healthcare environment, but also to review the first course. And Elizabeth, congratulations. Brazil was the top one in number of attendees. 361 people watched the video, the course.
Yeah.
So, and I'm sure many more people will come and see, as they are still available for quite some time still, Rosanna, right?
It will be available all the time. Yeah.
So I think ISBAC will now promote the course internally for the case studies, but also with the due time, we are going to announce and promote the course for September. And the main thing is that we can also engage people from Fiocruz, from Ministry of Health, also to use this material in their learning activities. That's also something that they do. And Fiocruz has a very important educational activity, and the people there are fantastic, and I'm sure they will take advantage of this material that is already developed.
Yes, I must say, the course is free of charge, and also we allow all the materials to be downloaded, for your teaching.
Yeah. Elizabeth, would you like to make any comment? Se quiser falar em português também, fica à vontade.
If you want to say it in Portuguese, that's okay. You're on mute. Oh, I'm so sorry. I would like to say something for our colleagues that are watching or that may watch in the future, but exactly. In the 48th Congress we had here in Florianopolis, we discussed a work that needs to be done by SBAC together with SBPC exactly about microbiology and antimicrobial resistance. So we are creating a joint program for local courses and on-site courses, because there's already a question of what's the best technique, what is the best approach. So this course is going to complement a need that most scientific institutions are noticing. So I'm very happy that SBAC is participating, and I'm very happy to know, and I think that most of our associates are going to participate. So I would like to thank Dr. Rosanna for being available for us. Thank you so much. And I would also like to thank you, Carlos, for this great opportunity, because sharing, that's what it is, to share content. When we talk about science, we need to share information, and that needs to be above any other kind of problem or solution. So I would like to thank you for the opportunity, and we love to be with you. Thank you. That's great. And actually, the most important thing here is to just highlight that this is a work in continued development. So this is how it started. Everyone contributed. We have a discussion forum in parallel. So everyone that participates, even though it's a pre-recorded course, inside that, within that period, people can ask their questions, they can participate in debates. That's why we have our local professors that help us, and as SBAC has been collaborating with that specifically to make this a more rich experience. And it is a support material for those who can't have the on-site course, right, Elizabeth? Or those who are there can have some kind of complement, because here, thanks to this network that Dr. Rosanna Peeling has, we're able to access the biggest names in world microbiology. And these are experiences in several countries, looking at similar realities and sometimes completely opposite realities, but that really open our eyes to this need. Because if you don't have diagnosis, you don't have appropriate health. And this is what we want to do. We want to bring the best diagnostic solutions, not only to identify or to detect. And even when we talk about susceptibility testing, to try to control this where there's time.
Rosanna, thanks a lot. I think we have covered in a very, very good way. It's fantastic. We always enjoy so much your presentations. That's the reason you're always requested to come. So
it's my pleasure. And
yeah.
I also like to say that, you know, having a course that is global in content, but having also local faculty, they could bring local all the concepts in the data in the local context, right? And to explain to the learners how it could apply to their setting. So hopefully that is why, you know, it's been so popular since we translated it into different languages. Yeah.
Yeah. That's true. And also another point is that we have to consider the One Health concept. Mm-hmm. We're talking not only about human health, but animal and environment. And considering all these three, we have no borders, actually.
Yeah. Mm-hmm.
The thing is that one problem that is happening nowadays in Africa can be the following day, the following week, the following month here. So nobody has control. That's the reason we have not only to do our own homework, but we have to, unite efforts and strengths exactly to go against as much as we can with this problem. So, but that's fantastic. Okay. Well, considering that, I really appreciate everyone that is on board, and for those who are going to watch now in our YouTube area. And also ISBAC is going to also promote the video. And you can already enroll yourself for the course of the case studies and wait for more very soon in September for the health-associated infections. A todos, muito obrigado, agradeço e até a próxima.
Thank you so much and see you next time.
Thank you. Thank you very much. Bye-bye.
Bye-bye.